And here to talk about that with us at a time when you need him here to talk about money and medicine, it's our friend Nick Tate, Newsmax Deputy Health Editor. Nick, the costs continue to go up. I thought Obamacare was going to cover people and was going to cost us less. What was that? $2,500 a family?
That was the prediction and the promise from the president, that Obamacare would lead to a $2,500 a year reduction in healthcare costs. And for the average American, it's actually the complete opposite. It's gone up by about that much if you look at some of these numbers, and even more in many states in the country.
Wow. Well, in fact, we've got that comment that's right here. Take a listen.
A system where we're going to work with your employers to lower your premiums by up to $2,500 per family per year.
We will start by reducing premiums by as much as $2,500 per family.
Here's what changes, saying to people who already have health insurance and the employers who are providing it, we'll work to lower your premiums by up to $2,500 per family per year.
I also have a health care plan that would save the average family $2,500 on their premiums.
Wow. So there's the rhetoric. You know, it's interesting. We've been focusing on the lie of the year being, if you like your doctor, you can keep your doctor. We go back there to that $2,500 remark, and man, that's another whopper.
Absolutely true. I mean, this is a case where the rhetoric and the politics of Obamacare don't match the reality of what the numbers have shown. And, you know, for a long time we've been looking at these claims that the president has made, and actually as Obamacare has rolled out, a lot of what was promised has not been delivered. And I think that's one of the reasons why people like Kathleen Sebelius have had such a hard time in defending this law. And now we are perhaps going to have a new defender of the law with the appointment of...
But are you saying this is across the board, though? Everyone's premiums are going to go up? I mean, could some people benefit from this? Are they already benefiting from this?
There are some people, it is true. If you have a pre-existing condition and you could not get health insurance before, or you're an older person and you were charged more, your rates could potentially be held down. But the vast majority of Americans are going to be paying more.
And then let's say smaller businesses decide to drop insurance coverage, which is happening right now. Some smaller businesses are doing that. That's actually helping some of the employees there that were paying more to offset the cost of the employees that were spending more for health insurance.
Well, it's a very complicated rubric there. The formula is very, very complicated. In fact, some people who are working part-time, for instance, at companies can do better with the federal subsidy that they get from the federal government if they buy as opposed to taking the company plan. But the concern is that employer-sponsored health insurance, which now picks up about 150 million Americans in this country, half of this country, may go the way of the fax machine over the next 10 years, and it will be replaced by a government-run health system. And I think a lot of folks have concerns about what that will mean in terms of their networks of coverage, how comprehensive their coverage will be, and what they'll actually get in terms of their insurance.
Mindful of that, there's a school of thought that despite the indignities of healthcare.gov and all the other inefficiencies, that this was essentially designed to fail, to bring about the rise of a single payer system and to offer this perverse incentive to businesses to get out of health insurance, pay the fine per employee, and put it all on the government.
Well, in fact, there are folks who believe that it was part of the design, exactly as you say. It's hard to know what was in the president's mind and what was in the mind of the folks who authored the bill in the beginning, and they will tell you that the employer mandate was really designed to drive more employers to offer insurance. But the practical reality, regardless of what was intended, the practical reality is that more businesses are getting out of the business of providing health insurance. And the consumer impacts could be significant.
Well, I know earlier didn't mean to interrupt you, but I know, like, we talked about it last week, where there were estimates of what, 90%, right?
90% by 2020. One of the new analyses coming forth that 90% of current employers would just get out of the health insurance business entirely by 2020.
Ezekiel Emanuel, who was in the White House at the time that the law was authored, has written a new book, and in the book he says that 75% of companies by 2025 will no longer offer health insurance. So we're really seeing a major shift in terms of the way healthcare is offered in this country in insurance.
you touched on it briefly earlier, a major shift in personnel. And no, I'm not talking about the Target CEO resigning today, although it's interesting to see the mirror of private industry and a hack attack going on to a website with what we've seen with the failure of healthcare.gov. Kathleen Sebelius, what now, a month ago announced that she was going to take a powder, ankle, leave, resign, whatever term you want to use. Her replacement, Sylvia Matthews Burwell. Do you expect smooth sailing for Ms. Matthews Burwell? Is she as ideologically predisposed toward Obamacare as the man who's appointing her? Mr. Obama, what's the book on Sylvia?
Well, the truth is that she's very well liked. She's not as polarizing as Kathleen Sebelius was. She's a Harvard-educated, former Rhodes Scholar. She was approved unanimously by the Senate to take over the position of the Office of Budget and Management in the White House and running the budget there. So the expectation is that she will be confirmed. In fact, you now have Orrin Hatch and John McCain and others saying they do not expect that they will hold up that confirmation. She will be confirmed, even if only the Democrats approve her. They're holding 55 of those seats in the Senate, and all they need is 51. But she is going to have to answer to all of the problems. I don't think it's going to be smooth sailing, and I think the hearings this week are going to be very contentious. And let's hope that it turns into more than just a political debate. Let's hope that we get to the substance of the questions that we have about how effectively and how not effectively the Obamacare plan is being implemented.
Well, it's interesting. You mentioned Orrin Hatch and John McCain, and for guys who promise a very tough fight in Senate confirmations, we've seen less than that on certain cases like this one from Sylvia Matthews Burwell. My question has to do with the current seats being controlled by the Democrats and their majority. Could we see a juxtaposition where senators from states that went for Romney suddenly get tough on this new cabinet member? For example, could we expect Mary Landrieu and Mark Pryor and maybe even Mark Begich to be very tough on the failures thus far of Obamacare?
Well, those individuals, among others, have been very, very strong in their criticism of what's been happening with Obamacare and putting pressure on the White House to make some of the tweaks. We've used this expression in the past. Instead of repealing Obamacare outright, a lot of the critics in Congress on both the right and the left have lately talked about kind of fixing as opposed to nixing the plan or amending it as opposed to ending it. We might see more pressure on those Democrats to take a tough stance in the confirmation hearings. That remains to be seen. What I really hope, though, is that this is not going to be, for all her likability, she seems to be very competent, Burwell. I do hope that we're not just getting kind of a smiley face that's being pasted on all of the problems with the Affordable Care Act. And let's face it, the next big battlefield in Obamacare is, we've spent a lot of time talking about the consumer impacts and the health care costs. We have yet to implement the employer mandate, which kicks in over the next 2 years. And so the question of whether the Affordable Care Act, which, as the president promised, would create jobs, another promise, is actually going to be a job killer. And that is what she is in all likelihood going to be overseeing and determining which way that goes.
Well, when you think about what could happen to jobs with this employer's mandate, I got to tell you, I have my skepticism, Nick. I think it is a smiley face, a kindler, gentler presentation on this program. And as I said earlier today, what concerns me, my former colleagues on the Hill dropping back saying, oh, we don't have to end it. There are other ways to get insurance to people with pre-existing conditions. There are market-based principles that can be utilized to hold down costs, and to lug along this anachronism, command and control from the government level in the form of Obamacare, seems to be a bit much. Nick Tate, we appreciate it, and of course we should point out that you put together the definitive guide on Obamacare that people are reading. There it is, the Obamacare Survival Guide, the Affordable Care Act, and what it means for you and your health care. Nick Tate, as always, we appreciate your insights and your evaluation of how the law is going. Now, when we come back, we'd love to hear from you. What's your take on Obamacare? What's next in terms of socialized medicine? Why don't you tweet me your comments at newsmax.com, #AmericasForum.